Hello, my name is Denis Jodoin, and I'm a third-year nursing student here at Northwestern Polytechnic in Grande Prairie, Alberta. I'm very blessed to have this opportunity to share some research with you all that surrounds the vulnerable population here in Grande Prairie. There is a great level of complexity that resides embedded deep within the relationships of the homeless population and their vulnerability, their mental health, their lifestyles, and their accessibility to medical interventions. Society has already accepted the need for additional resources to be provided to the vulnerable population by providing a myriad of professionals that assist with their holistic needs, yet there still seems to be a gap that the specific population is falling through. The Wapiti House is a shelter in Grande Prairie that provides support to the homeless population. The main floor, coined the term frontline, is where the clients have access to a mat intox program that allows for a safe, warm place to sleep during the day and during the night. The first floor also consists of a cot program where the clients can seek emergency shelter and have a dedicated bed with access to food, laundry, lounge, bathroom, and showers, but approval for this program is contingent on set boundaries and conditions. The second and third floors of Wapiti House are dedicated to supportive housing. These residents have a low income status and mental health related symptoms, but they have a great team of professionals from Alberta Health Services that are on site to address and oversee their holistic needs during the day, Monday to Friday. This leaves a population of approximately 80 individuals that are in the shelter cot program and the mat intox program without a healthcare professional on site, requiring emergency medical services to always be dispatched to site to deal with any medical needs that are required. The objective of this research is to develop a proposal for the addition of an RN who will provide on-site healthcare to clients in the mat and cot programs. This will demonstrate that much of the expense of an RN position would be recuperated by the reduction in costs of ambulance calls to Wapiti House. During the fall of 2021, I had my clinical placement in mental health at Wapiti House. Within 2 weeks of learning my role as a frontline worker and becoming orientated to the functionality of Wapiti House, I immediately knew that the homeless population were trapped in a vicious cycle within their own mental health ailments, their addictions, and their inability to navigate their own healthcare. With having no healthcare professional dedicated to the first floor clientele, due to the transient nature and lack of permanent residency, I knew I needed to jump into my nursing role as a student and within my scope of practice. I was overwhelmed with the barriers that these beautiful souls had to overcome and found myself dressing infected wounds, reviewing and dispensing medications, assessing physical and mental well-being, and bridging the gaps between what is needed and their healthcare accessibility. It was found that many clientele had severe distrust with healthcare and the associated professionals due to the bias within healthcare in relation to mental health and addictions. As time lapsed in my position at Wapiti House, I had established a therapeutic trusting relationship with many clients, and they were confident that I was there as a servant to them and I was centered to their care. By the end of my clinical rotation, I was incredibly busy practicing my nursing skills and had found myself working above and beyond the required hours of the clinical rotation, as I was able to create good rapport with the clientele, and many of them were seeking help, which was now available to them in their environment. This is a concept map of my clinical experience at Wapiti House, interprofessional collaboration, and the associated barriers. I was able to identify barriers in almost all aspects of creating success in their health and well-being. There is an incredible amount of professionals in and out of Wapiti House that is involved in the success plans for the clientele, but there is nobody available to them on their turf that specializes in navigating healthcare and healthcare literacy. A RN on site who specializes in advocacy, interprofessional collaboration, and management would be an asset to these individuals and would bridge many of these barriers that are experienced. Let's talk about finances. I believe this is a situation where money will need to be spent in order to save money. And this brings me to requesting data from Alberta Health Services. A FOIP request is a formal request for information, and it has associated costs that is dependent on how much information is required from Alberta Health Services. In submitting this FOIP request, I had asked for the frequency of ambulance calls to Wapiti House, how many clients required transportation back to the hospital, how many of the calls were related to opioid overdoses or poisonings, and the cost of paid and unpaid invoices related to the call. Unfortunately, through this FOIP request, I did come into a little bit of a barrier, as the cost of paid and unpaid invoices requires a professional a significant amount of time to dig through, and I did receive an invoice of $2,363.50 in order for them to start digesting some of that information to provide to me. The following is the information I did receive. All event count is the total amount of times that an ambulance has been called to Wapiti House. Card 23 is considered an overdose poisoning, and transport count is the amount of times that the clientele require transportation to the hospital. The Government of Alberta has standardized ground ambulance patient charges to $385 if a patient is transported, $250 if a patient is not transported, and a $200 surcharge if the patient is a non-resident of Alberta. This translates to the RN's position at Wapiti House by absorbing 47% of the calls for an ambulance, as these individuals do not need transportation to the hospital, but do need medical attention, to which the RN can provide. In using the number of 47% and using the $250 amount provided by the Government of Alberta, this translates to a savings of approximately $40,688 per year. But further research is required on how many of these individuals are from out of province, as this would add $200 per event and could significantly add to the potential savings. When creating a role for an RN, it is noted that a budget of $110,649 per year is required, and this covers the wages, benefits, Canadian pension plan, and other associated costs of employment. The potential savings from ambulance calls alone will not fully cover the expense of an RN role, but there are other nurses that frequent Wapiti House to dispense opioid treatment medications, perform sexually transmitted infection screening, vaccinations, and infectious disease testing that could be eliminated and added to the workload of the on-site RN, which would further save associated costs of having public health nurses visiting Wapiti House. The harm reduction approach and health promotion activities that the RN is capable of implementing can further catch health-related issues early in their processes and aid at preventing hospitalization, which can further save the expense of $7,992 towards the average cost of a hospital stay in Alberta. I am certain that through all these financial savings, that the position of an RN at Wapiti House would certainly pay for itself. But further research is required to show what that exact number would look like.